Hi everyone, welcome back to INFOMEDS. Today's video is all about what you must avoid if you're taking Amlodipine, Norvasc. From foods to medications and even herbal supplements, some things can increase side effects or make this blood pressure medicine less effective. So let's break it all down simply, and stick around for some bonus safety tips at the end. Amlodipine is a calcium channel blocker. Used for O. High blood pressure. O. Chest pain, angina. O. Reducing stroke and heart attack risk. It works by relaxing blood vessels and improving blood flow. Test tube how it's processed. Broken down in your liver by an enzyme called CYP3A4. Anything that affects this enzyme can increase or decrease amlodipine's power. Cup with straw grapefruit and grapefruit juice. Blocks the enzyme, CYP3A4. Causes too much amlodipine in your blood. Warning: can lead to dizziness, swelling, edema, low BP. Wine glass alcohol. Enhances blood pressure lowering effects. Risk: fainting, fatigue, dizziness. Tip: if drinking, limit to 1 small glass and never on an empty stomach. Seedling St. John's wort. Boosts CYP3A4 enzyme, lowers amlodipine level. Reduces effectiveness, especially for blood pressure control. Herb ginseng and echinacea. Also increase CYP3A4, less amlodipine in your body. Commonly taken for energy or immune support, be cautious. Stop sign pro tip: always ask your pharmacist before mixing herbs with heart meds. 1. Simvastatin. Amlodipine raises simvastatin levels, muscle pain, liver stress. Doctors usually reduce simvastatin dose if both are needed. 2. Sildenafil, Viagra. Both lower BP combined equals too much drop, fainting risk. 3. Steroids, like prednisone. Increase CYP3A4, reduces amlodipine effect. Watch BP closely if you're on both. 4. Tacrolimus, cyclosporin. Used after transplants, interaction may increase levels. Requires doctor monitoring and dose adjustment. Stop sign: also watch out for NSAIDs, e.g., ibuprofen, may reduce BP lowering effect. OTC antacids can slow absorption, take 2+ hours apart. Timing: don't take amlodipine with grapefruit in the same 12 to 24 hours. Avoid sudden standing, to prevent dizziness. Monitor blood pressure regularly at home. Tell your doctor/pharmacist all supplements and OTCs. Lotion bottle for elderly patients. Risk of falls as higher doses may need to be lower. Pregnant woman, pregnancy. Amlodipine is not typically first line for pregnancy-related hypertension. Talk to OBGYN. Avoid these with amlodipine. Grapefruit and juice. Alcohol, limit it. Herbal supplements, St. John's wort, ginseng, echinacea. Interacting meds, simvastatin, Viagra, steroids. OTC painkillers like ibuprofen. I hope this helped you understand how to stay safe while using amlodipine. If you found this video useful, give it a like and don't forget to subscribe for more doctor-approved tips on medicine and health. Drop your questions in the comments, and see you in the next one.